heart is beating in there nicely. So it's nice and active there. Sometimes we can get a nice picture of the face here. It doesn't always work, but we'll give it a little go. Facing the wrong way. See the baby just lying in there? Moving about. Its hand up to look at us, so we can see quite easily that there are 4 fingers plus 1 thumb there. So that's looking good. Now, get on to some technical things we need to know. The first one is little bone in the nose. Longer this bone, lower the risk of Down syndrome. That's a normal length. Next thing, we have a look at the heart, because baby's in the perfect spot to see the heart, and sometimes this is the hardest part of the whole examination to do. So we have a look just here. We can see cross section through the chest. The heart is beating right there. So you're surgical registrar. So
yes,
this is one of these things you wouldn't know anything at all about then.
I did a cardiac term once, but we only really dealt with the outside very much.
So we can see that heart beating away in there beautifully. We can see the 4 chambers, the 2 ventricles, the 2 atria, septum coming down the middle. Little valves opening and closing there, looking good. The blood flow through the heart. This one shows us blood flow into each side. You can see baby started squirming there, but what we're seeing particularly is flow up each side, no flow across the septum. So no evidence there of a hole. This is where the aorta, the main blood vessel, comes out. The artery, the other blood vessel crossing it, and they look normal. Perfectly fine, nice orientation. So let's just look at that heart from a different angle just there. It's looking absolutely fine, so that's good. And baby's off on the move. Quite considerably off on the move. But a good looking heart.
Much better.
Little heartbeat there before it ran away again. And we get a heart rate of 146 beats a minute, which is perfectly normal. Cross section through the top of the head just there. We can see there the oval of the skull bones. We can check the size of the head. Again, we saw it, of course, in profile there beautifully, but this is just looking more technically at the front of the face. Got an arm up beside it, but there's an eye just there. You can see round lens. Come around to that one. There's its lens. Little nose, 2 nostrils, and the upper lip just there, looking fine. Look at the details of the face as a bird's eye view from the top of the head. We see the forehead bones. We come on down. There's an eye there, and another eye just there. Little nose. Upper lip and hard palate looking normal, and lower jaw looking fine, and that all looks perfect. So no evidence of cleft lip there, looking absolutely fine. Look now at the brain. We can see the midline that divides 2 halves to the brain. You can see one of the lateral ventricles, fluid filled space in the brain on that side, looking good. The other lateral ventricle, looking normal. Cerebellum, balance center at the back of the brain. Now you mentioned something about spina bifida. Tell me a bit more about that.
Luke's got had a fracture of his back, and they found it on CT scan, and we want to say the same thing. Just
Spina bifida occulta, you mean?
yes. Yeah. I've been on because I had the termination before this pregnancy. I've been on follow for a very long time. So.
Yep. The termination before this pregnancy.
Sorry, DNC. Sorry, non-viable fetus at 8 weeks.
All right. So coming on down, we can see the stomach. See where the 2 kidneys are. Now this is the spine itself. Now spina bifida occulta is not detectable antenatally, and is a completely different condition to spina bifida
There's no association.
Well, there is a weak association, but not really, because up to 30% of the population
I was going to say, I thought everybody basically had it.
Yeah, whereas true spina bifida is quite a different thing. The trouble is that people, just drop the word occulta from it. So there's no real association, but there's no significant risk association between having the two things, or else everybody's by definition at risk almost.
Yeah.
So this baby will probably have spina bifida occulta.
Don't worry, mate.
Well, that's right. I mean, having a backache is just fact of life, isn't it, really? At some stage. So this is looking at the hands out there. We can see the four fingers and thumb there, looking good, little fist. And the other hand just spread out there with its fingers spread out there beautifully, moving so fast I can't see it. There it is. You see those fingers?
Yeah.
And they're moving around very nicely. There we go.
Oh, lovely.
Ran away. But it was impressive before it ran away, that's right. So the spine there we're seeing from the back again. We see the little spinal bones, the ribs, shoulder blade, all the way down to the base of the sacrum there and the hip bones, and it looks perfectly normal. And lining up there nicely. And so that all looks fine. So there's no evidence of real serious spina bifida. And we'll pick all but the most minor cases of that. And as we discussed, we just won't pick spina bifida occulta because it's just too subtle at these early stages. Kidneys, we look from behind, in cross section just there, the oval just there, and there are the two kidneys. Looking through from the back, they look like little C shapes, just here and here, both in the correct position, other side of the spine. No unusual positional issues with those. This is the thigh bone. You're going to have to forgive me using lay twos all the way through.
No, that's all right. I still like
Works
to
for me.
hijack people into finding out after the code, after the situation.
Waist, that's the stomach.
What's the thigh bone measurement for?
It's just one of the routine measurements we take to check size. I mean, it's associated with a whole lot of abnormalities if it's too short.
Yeah.
But your measurement was fine, so I won't scare you with all those. This is the rest of the leg. It's right up near your belly button. Hard to scan through your belly button, so I'm just trying to get the right angle for that. In fact, we'll leave that for a moment. We'll come down to the arm bone, humerus, just there. Same story, short humerus associated with all sorts of problems, but the measurements is normal. Forearm bones just there, looking good. The hand there again. And the other arm just down there with its forearms, and again showing off its fingers beautifully. So baby's kneeling up there now, so there is the foot, no talipes. And the other foot just tucked up there, tucked up in front of the bottom is there. And they're both looking good. Carefully, you see that there are 5 little dots on the toes. The other foot, as you saw, tucked down, right down, quite low. There it is. And you can see it's 5 toes too. So that all looks good. So baby's looking good.
Good job.
And we check your cervix, make sure it is normal in length, just there, which it is. That's your placenta on the back wall, normal position. And that bright stuff there, that's the placenta there. So the baby's lying on it. There's that spine once more, showing it's nice and straight. So baby looks great. Not seeing anything at all to worry us there, which is wonderful. So, any questions about Junior that we haven't covered? This is where the umbilical cord goes into the tummy. This is the blood vessels that surround the bladder to supply that cord, and they are looking good.
No way you can tell
No.
Our first baby had a very short cord, and
Mhm.
was the reason for emergency Caesar.
Yes.
It was sort of like 15, 20 centimetres, something like that.
Yeah, no, I mean, you
Yeah.
drop a
Imagine
hose,
it's
drop a hose
really
on the
hard,
ground
yeah.
and you can't
Yeah.
get out.
Makes
So, no,
sense.